everyone. This is Chadi Alraies from NCVH in New Orleans 2023. I'm really privileged today to be with Kymberlie McNicholas to talk about a very interesting and a very important initiative called Way to My Heart, .org. So, Kymberlie, thanks for being with us.
Thank you.
Tell us about this organization.
So the Way to My Heart is it started as a movement and it turned into an organization. I'm an Emmy award-winning journalist by trade. I worked at Forbes magazine and was on CNN and Fox News Channel and all of the above. And I decided to take a break from journalism at one point because my beat was Silicon Valley entrepreneurs or entrepreneurs around the world. And I decided I wanted to be one myself and start my own company, which was an asynchronous video interview platform. And during that time, as I'm trying to build this, Sir Richard Branson's team reached out to me and said, hey, we have this startup competition, would you mind helping us out? And I got more and more involved with this startup competition where I ultimately ended up being the executive director and MC, for the top 10 finals, the top 3 on stage on his private island. But I was hesitant to take the job. And he said, just say yes and figure out how to get it done. Don't let what you don't know and have never done before get in the way of doing something great. Sometimes it's what you don't know and have never done before that could be your greatest asset and create the greatest disruption in any industry. Correct. And it was a mouthful, but if you look at his career and some of the greatest entrepreneurs of our time, they weren't in the industry in which they created the greatest disruption. Even with him, with airlines, right, or outer space, whatever it may be. But it was during that time I ended up vetting more than 5,000 startups around the world, and it was in that, vetting process I discovered that innovation was moving at the speed of light for healthcare. So I decided to partner with an organization that sponsored a radio show, which I grew into the #1 radio show for business in the San Francisco Bay Area at the time. And a big focus was on healthcare innovation. Okay. I ended up interviewing a couple of doctors who were telling me, you really have to focus on cardiovascular medicine because big things are happening. Life and limb are going to be saved. And I said, limb? What do you mean limb? And they said, well, 3 in 5 people who suffer a heart attack have what's called peripheral artery disease. And most of the innovation that saves lives starts out saving limbs first. So I found a company that was getting ready to start their FDA clearance process, and I'd asked them, can I travel the world with you and watch and film every single one of your cases and follow you clear through global commercialization and share this with the world, not necessarily your product, but the process by which a medical device that could become one of the biggest breakthroughs actually goes through and gets there. And so I was able to travel the world to nearly a dozen countries, more than 30 states, watching hundreds of doctors perform thousands of hours of these life and limb saving procedures, both in the legs and the heart. I've watched even bypasses. I've watched my fair share of amputations, which you can't unsee that and never want to see another one again. It made me more and more determined through the process, seeing that different doctors, different tools, different techniques, different philosophies, even along the lines of the different practices, would make the difference in patient outcomes. Yeah. And I was noticing that here's a doctor at this large facility that has these limitations. Standard teaching protocols dictate if you can't stent a particular artery, then you can't treat it. Send the patient to amputation. And meantime, just an hour and a half away, there's another facility where a doctor is using a device. They don't feel the need to stent. They're able to treat it, and the patient walks out a few hours later. That was just eye-opening for me. And
very heterogeneous kind of practice across the board.
And so I ended up going on social media and starting to bring the information to the patients, just seeing what patients were saying and saying, hey, have you asked your doctor this? Have you asked your doctor that? And I believe if you ask the right questions, you get the right answers. The Emmy that I won was for my interview skills. And I always believe you gotta ask the right questions to get the right answers. So I was helping the patients in that way. Where my organization finally came into place is when my dad was on the verge of a heart attack. And the doctor said to him, well, I think you have indigestion. I'm just gonna give you some Prilosec. And I said, I think you actually need to do an ECG She said, no, I don't have a diagnosis code for that. I think it's indigestion. And I said, he's 78 years old. And he has a family history. Both his parents died of it. I think it's about time. He's never had his heart checked. I think this is more than that. And it was through that process of, yes, he did have an abnormality. He ultimately was put into a nuclear stress test. And then they wanted to throw him on the table the next day. Not because he needed an emergency, percutaneous treatment. They just happened to have a cancellation. And so I said, hold on one second. I want a CT scan. They said, no, he's going to have an angiogram anyway. And I said, I want a 256 slice CT scan. I want 3D modeling of the heart, and I want to have a productive and satisfying conversation about what tools and approaches that you plan to use or have in your back pocket for my dad.
Serving as an advocate for a patient.
Yep. And I was like, and I want you to use IVIS, and I want you to use Boston Scientific Stent, and I was literally specific. And the doctor was very impressed. He said, do you do this professionally? I said, no. He said, you should. And that's when the weight of my heart formed, and I figured out, well, I know most about PAD.
Yeah.
And so that's where it really formed. And we started out just helping one person and then another. And then when COVID hit, we catapulted into the thousands of patients. We even had doctors calling us saying, hey, do you know of a doctor that my cath lab's closed? I don't have enough staff. I have to get help for this patient. And we were able to help even coordinate 4 doctors to get patients to limb-saving care during COVID.
So what is the mission of the organization?
So we're life and limb saving. That's our whole goal. Our passion, our purpose is saving life and limb. We provide comprehensive education, high-touch advocacy, and real-time support for PAD patients around the world. Our goal is to remove any financial, emotional, or geographical or logistical, things in order that's preventing a patient from getting timely, effective limb-saving care. So we, for example, will help patients find the right doctor using criteria for a CLI fighter, standard protocols for what defines a CLI fighter. We help provide transportation to and from appointments. We provide healthy food for patients that need it. We help look for resources in their area as well that can provide more regular healthy food for them. But we're really an education organization, and
for the patients.
For the patients.
And this is available online. The patient can log in.
Yes.
And they can check the information.
They can log in. We also have our Leg Saver hotline, which we're building out with great partnerships, where patients can call anytime, anywhere, and get real-time support, get information that they need in order to ease their anxiety, ease their stress. So many doctors don't have the time to sit and really explain things. And when patients go to Dr. Google, what is the first thing that comes up? 5-year mortality. You have PAD, you're going to die.
Yeah.
And what we do is we say, whoa, take a step back. We're empowering you with the resources you need and the information you need to live a better life. Right. We bridge that gap between appointments, supporting doctors and the healthcare teams and supporting patients to make sure they don't fall through the cracks. We have lifestyle modification programs. We have our text-based walking program where patients have their own dashboard and they can see how they're progressing. We're the only one that has claudication time, which is that key component, that key measurement, that key moment where a patient has the best opportunity to grow those collateral vessels if they push through the pain, and the patient can measure it. The patient can email the doctor with these results as well.
Right.
And it's really fun. But
I'm really glad you have somebody like you kind of advocating for and having an organization.
yeah.
I'm hoping that one day there's going to be a collaboration with the American Heart Association, American College of Cardiology, but definitely starting an NCVH, this is the right platform. And being here is a big plus. I learned a lot of what option we need to give to the patient,
Yeah.
but also your contribution is you're making the patient aware of what needs to be done
Yeah.
to get the treatment they deserve.
We become their friend in health.
Yeah.
Half of our conversations when we're talking to them on the phone or via text, they always say, I love you, you're my angel, and it just warms my heart that people feel like family with us. We've developed a culture, not only is it one-on-one, but we're community-based as well. The culture that we have developed is just unreal, that these patients are so inspired, and they don't define themselves by their disease, they're inspired by it because of what we're doing and the family that we've created. And I have to give you a great example. I am a little bit of a pad nerd, and I really immerse myself in the whole process. And the other day when I was out getting my dad to walk, I was waiting for him, and I just started bopping around, and I was like, 1, 2, 3 o'clock, 4 o'clock, walk, 5, 6, 7 o'clock, 8 o'clock, walk. And I was like, that's a great idea, Dad, here's my camera, film me. And so I put it up in the group. Next thing you know, one of our patients who was in a Houston hospital, he's a fall risk, so he can't get out of bed. He did a video of him just shuffling his feet, and he's like 1, 2, 3 o'clock, 4 o'clock shift. And he started doing it, and then he tagged someone else, and he said, it's your turn. And suddenly we have literally more than 24 videos, and it's turned from a rock around the clock or a rock around the block to rock your walk. And they're now sharing it publicly. And just today, I ended up with a couple organizations that have nothing to do with PAD, who are sharing it and challenging other people. So I'm hoping that maybe it'll be like the ALS challenge, the Ice Bucket Challenge, that maybe this becomes viral, which would be really fun.
Increase awareness as well. Well, Kymberlie, thanks so much for you do and the organization you put together with your team and to make awareness of this significant disease. Watch these videos and others on NCVH YouTube channel. This is Chadi Alraies from New Orleans. Thank you so much, Kim.
Thank you.